And you talk about creating boundaries in your book, which is a really good concept. I don't think we've talked about that much on this podcast, but can you talk a little bit about creating the proper emotional boundaries with your patients? I think that's something we struggle to do with. We struggle to do properly a lot in the ER, and that kind of leads to burnout for us a lot.
Yeah, emotional boundaries are kind of this separation between myself and you, right? And I think that physically that's easier to do, right? I can see where my body is and where your body is. Even psychologically, that may be easier to do, but emotionally is where it gets a bit more porous. If the person in front of you is very sad, you yourself may feel sad. Or if the person in front of you is very angry, you may start to feel that you feel angry. So this taking on of other people's emotional experience, that's what empathy is, right? And so in some sense, that is celebrated. Oh, you're so empathic, right? Empathy is not good unless it's paired with a good boundary. Trust me, empathy will eat you alive unless you pair it with the proper boundary because just feeling other people's feelings, oh my God, yikes. It's like being able to be a mind reader. No, thank you. So that's one reason why we're at risk because we are highly empathic individuals in healthcare. We're picking up on the energetic presence of people around us, and we've never been taught how to boundary against that. So, what does an emotional boundary look like or feel like? It really is just saying, oh, I see your feelings, and they're not my feelings, right? And I don't have to have the same feelings as you because we're two autonomous persons. And in fact, I am going to have an emotional experience as a professional person, going to have an emotional experience that is most beneficial and most helpful to me doing my professional role. And so if I were to ask you, like as a PA in the emergency room, what emotional home base would you like to be in most of the time?
Probably calm and level-headed, and being that calming presence, I think, is what I try to strive for.
Present. That is probably not the emotional experience of most of the patients, right? So empathy is actually works against you. If you were empathizing and like, I'm going to feel how you're feeling, you're not in an emotional state that leads you to your highest capacity as a worker. So that's kind of where we need to A, recognize that dynamic and B, put a boundary in place. Boundaries can look like mantras, just saying something as simple as what I just said. That's your emotional experience, and I have my emotional experience. Boundaries can look like some little rituals. Sometimes I do like a little clearing ritual after I see a patient where I feel like I've taken on a lot of their emotionality. Particularly if it's very sad, there might have been a lot of tears. Just kind of like shake it out or dance it out, just to clear. You can't fully prevent that you take some of it on, but you have to recognize that you did and then clear it out because you also recognize that then you walk out of the room and then you have to go do maths or write orders or talk to someone else in a professional manner. You can't be carrying that along with you. The other thing is that it's very depleting, right? And bearing emotions without letting them process and move on, they just live in us and drag us down and cause a lot of. That's why people call it compassion fatigue, but it's really empathy fatigue. But that's why this entity exists because you feel like, wow, I started the shift feeling pretty good, but by the end of the shift, I'm just like wiped out. Putting boundaries in place, again, really just saying what's yours is yours and what's mine is mine is the simplest version of the boundary. And this, if really just recognizing it, you'll start to do it. There's no magical like practices or like I have to be a boundary setter. You just have to say, I have to not want to collapse into my patient's pain. That's no good for either one of us. And if you can just say that, you're going to do the boundaries. They're going to just come naturally from that belief.
Do you think it's ever healthy to, maybe not on every patient, especially in palliative care? I think you guys deal with this probably more than we do in the ER, dealing with big emotion from family members, from patients themselves. Sometimes I think like if I spend extra time with one patient out of the day and maybe empathize with the one patient, maybe that's not as much hard on my emotions as if I'm doing that with every patient. Do you think that there's a level that you can do some empathy and also achieve that balance, or do you think it's more important to maintain your professionalism and objectivity every single time? Or is there a balance there, I guess, where sometimes it's okay, sometimes it's not? What are your thoughts on that?
Tell me about the intentionality, because that's really where it's going to matter. Like, why would you want to do that?
I guess the ones where I'm most tempted are where I can see my own family in that patient or in their family members, or they're dealing with a similar emergency maybe I've dealt with personally, and I can relate to them a little bit more from my own personal life. And that's maybe where, like one example is, we deal with a lot of miscarriages in the ER. We're the front line for vaginal bleeding and early pregnancy all the time. They don't see their OB doctor, they come into the ER oftentimes. And having gone through that myself, I feel like I can kind of relate to that patient. But if I spend that extra time with the patient and I really empathize with them, and even if I'm tempted to bring my own personal experience into that, I don't know that that really does me good at the end of the day. Maybe it does. I don't know. I don't really know the answer.
Yeah, so thank you for that example. It gives me something to latch on to as I think about this. I think that wanting to look for clinical areas of excellence, right? So, do I have some special skill beyond any other PA or physician in this ER that can help take care of this patient in a different and unique way? Maybe personal experience is that, but we have to identify it that that's a skill that like a life experience skill chip that we're bringing and that we're deploying for a clinical reason. We have to always remember to be patient centered. What is the patient's benefit of me doing this? And if there's no benefit to the patient, then maybe you need to put that somewhere else. Recognizing, now this is the key point. Wow, this touched a little close to home for me. It brought up some feelings in me, which made me tempted to want to spend time with the patient as a place to process those feelings. But what I really should do is go talk to a colleague or maybe my therapist or maybe my parents or wife or whoever it is that's your safe space to process emotion and say something like, I had this patient that felt very much like something familiar and I had these thoughts about it, but I didn't really think that the patient would benefit from hearing that, so I put it somewhere else. That's probably the way that I think we should boundary around that. It recognizes our own humanity, that of course interactions with patients are gonna bring things up in ourselves, and it recognizes that being able to put that somewhere is really important for us. I would never say just put that in your pocket and go home and don't talk to that patient about it. Like that's not the right thing either. But that we really do have to say, is this a patient-centered reason that I'm bringing this into the room? And most of the time, it's not. Sometimes it is. I do self-disclosure sometimes. I have, or I share things from other patients sometimes, right? Oh, I had a similar patient and here's what they did. But I have to sort of wield that. We have to wield that incredibly carefully and intentionally and make sure that it's for the patient's benefit and not just because we want to sort of process something ourselves. Our patients should never be the
That's a
That's a
great answer.
responsible
That
party
makes a
for
lot
us
of
to
sense.
process our emotions.
Yeah, absolutely. I like your point about spending more time to reassure and answer a patient's questions. Will actually improve efficiency in some instances, especially in the ER where efficiency has to be such a huge priority for us because we see so much volume. We need to sort the patients that are dying from the ones that are not, get the ones home that are safe to go home. And I found this to be true a lot of times where I won't spend as much time with a patient discussing the plan and the follow up, what we think is going on, all the things we know aren't going on, which is often our role in the ER is to say, we know none of this is going to kill you. You're safe to follow up outpatient. But if I don't spend that time to kind of set the proper context and tell them the plan and reassure them that this is why we're confident in this plan, they go to be discharged and the nurse is saying, hey, they want to talk to the provider again, or, different things like that. So I think that's a great point that spending that extra time often will actually increase efficiency down the road when this patient doesn't have a whole bunch of questions that you forgot to answer initially.
Yes, and asking them what they're worried about really right up front is often a big time saver as well, because it's often not the thing that we might anticipate. And so I know I have observed other people, and I've done it myself, gone on a lengthy spiel of all the things that I think they need to know. And then they tell me they were worried about some completely other thing that had nothing to do with it. And so it's not only being willing to spend a little bit of time up front, but also partnering with the patient right from the beginning to understand what communication would be most helpful to them. Um, and then just, building rapport, which can be done incredibly rapidly. There's a belief that, to establish rapport and trust with patients, we need to spend a lot of time. That's not true. You just have to be willing to be a human being. And so the more all of the time invested into your self-study, self-development, and, lighthouse lighting is time well spent that will pay off because you will be able to easily connect with other humans instantly, and develop rapport and trust instead of having to go through all of these maneuvers of ask me about your dog, tell you I like your shoes, like all these little funny things that we may have been taught of like how to build rapport. If you just show up as a human being, people feel that.
Yeah.
And that you can't fake it, which is why if you're burned out, you have to sort of go through the whole song and dance to pretend to be a human because you've kind of been dehumanized, right? That's what I want to correct.
Yeah. I think that's a great question. Like, what are you worried about? Because often I'll see a patient for chest pain and I go to discharge them. You're not having a heart attack. You're not having a PE. You're safe to go home. And they're like, well, am I having a stroke? And I'm like, a stroke? That wasn't even on my list of differentials, and if I had asked that question up front, oh, they're worried they're having a stroke. Well, here's why we've ruled that out clinically. You don't need testing for that, but they're sitting in their room wondering why we're checking out their heart so thoroughly while they're worried about a stroke. And you totally miss that opportunity if you don't kind of cover your base up front and just ask them what they're worried about, because you're so right. It's very different oftentimes than what we think is going on or what we think they're worried about. So that's a great point. You also talk about this unconditional positive regard. And I think that's such a great practice to get into. Can you kind of explain unconditional positive regard?
This is a wonderful example of why working in teams is such a amplifying impact in healthcare because this is a concept that I learned from working with chaplains and social workers and psychologists. So this is a fundamental tenet in the training of those modalities, but is of course helpful for anyone in a helping field. And that basically is regarding the person in front of you, your client or your patient, as fundamentally good, regardless of anything that you know or don't know about them. And that can be very challenging, particularly, I imagine, in emergency settings where things that you know about them may be very hard to hold, right? They've injured someone else and or responsible for some harm committed towards other people. That's sort of an obvious example, right? But just being able to clear that and say, I see good in you. This is also comes up in my world a lot in patients who are incredibly impaired, can no longer speak, can no longer move their limbs, may have significant neurologic impairment and being able to approach them with unconditional positive regard. Your life has value. I see the inherent dignity in you as a human, even though you've lost so many of the capabilities that most typical humans have. So those are kind of two ends of the spectrum, but and then everything in between, right? Someone who's being angry, someone who's being overly demanding, someone who's sometimes we would say challenges our compassion, right? Somebody who's making it hard for you to love them, though that's when this principle comes up. If you do have children, you get to practice this quite often because the love for your children is deep, and yet sometimes they're just little turds. And it makes it really hard for you to have unconditional positive regard when they're screaming and demanding things. So, but remembering that they are goodness incarnate, right? We all are. And that allows us to interact with people in a way that can allow them to be the best version of themselves. Um, so that's why that concept is really important and I think feels really good. I think sometimes we feel like self-righteousness and judgment feel good. We get stuck in that a little bit. They're traps, but you obviously very graspy ones, very sticky ones, given the rampant social media, the things that are on social media definitely tell you we like to talk about negative things as human beings, right? But the truth is, we don't really, because there's always that little like moral residue of like, oh, I'm kind of not being a very nice person right now. People are good. I believe this. I believe people are good. I believe that things have happened to many of us that make us act in less good ways more or less of the time, but that if we can believe that other people are good, that also means we can believe we are good. And then that amplifies us towards behaving in ways that sort of generally improve the whole society.
Yeah. I love that framework because I think so much in the ER, patients are angry about their situation and we're the target for their anger. We're the person that can't solve their problem and we don't have a good solution for them oftentimes. And so we're a good outlet for their anger, but understanding like they're not really angry at me. They're angry at this situation. And I think if you operate from that framework, you can actually talk to them a lot better, understanding that they're not really angry at me, they're angry at this situation, and we don't have a good solution for them. But you can actually, I had a patient recently that was a very similar situation. She was very angry, and she was angry we didn't have a good solution for her. But I understood her anger wasn't targeted at me, so I spent a couple of extra minutes and was actually able to come to an understanding and a good plan for her at the very least. Whereas I could have just walked out of the room and told the nurse, hey, she's going to leave, she's angry, and left it at that. But instead, I spent that extra couple minutes realizing that I don't need to take this personally. She's not really angry at me and the care that I'm providing. She's angry about the situation and actually be able to come up with some of a solution for her, even if it's suboptimal. But
Yeah. Get on the same side of the table is kind of another tactic that's in the situation you're talking about. So if I can see that this person is fundamentally good and I'm judging them with, or not judging them, right? It's non-judgment, universal positive regard. And I can recognize that we're actually on the same side of the table and the problem is out in front of us, right? That's the adversary, the problem. You are probably equally as frustrated at your lack of solution for this woman. It's not like you were like, I want to not solve your problem. Of course not. So when you can change that dynamic, even if it's just in your own mind, that does put some of those boundaries in place, kind of some of that reframing that can often unlock the solution that you couldn't see when you were locked in that her versus me kind of dynamic.
yeah, that's great. I really enjoyed too your discussion on inspiring others and working on maintaining a positive outlook, smiling at people, telling them you're glad that they're here, to staff and patients alike. And I think that kind of stuff goes a long way in our workday, and it's something that I'm always actively trying to work on. One of our ER registration folks is super great at this. He learns everybody's names. He goes out of his way to say good morning to you, and he like looks at you in the eyes when he's doing this. Like he actually wants to know how your day's going. And I know his face above everybody else's because he's so good at kind of inspiring others. And it's such a small thing that he does, but it makes such a huge impact in my day. Why do you think this is so hard for some of us to practice at first?
Well, it's really culturally discouraged. Sour faces and mad at the world is really culturally normative in medical culture. I definitely have been criticized for smiling too much. I have been criticized for, like directly from superiors, have been told you smile too much, which I was just politely disregarded. Like, okay, fine. But if that's the worst you got, like, okay. But just to say, right, like that would be feedback, is one thing. Yes, there are places where it's inappropriate to be laughing, telling jokes, or perhaps even smiling in some clinical scenarios. But when you're in the hallways with colleagues, is never a place where we should be telling people not to smile or not to be friendly, right? So that's kind of one cultural thing that unfortunately still persists. I do think that there's some gender dynamics at play that women may feel that we need to be taken seriously and therefore, being smiley and polite and friendly may erode our authority in some way. And that, I mean, that may or may not be true. You have to make, these are value choices, right? I told you happiness, joyousness is one of my values. I'm willing to take the risk of someone thinking I'm either like a ditz or not professional or just deliriously like Pollyanna happy. Like those are all beliefs that people have had about me, and I'm willing to let them have them because it's important for me to do what I think is important, right? So those are all the reasons why it's hard um, to do it, even if you feel it. And then it's hard to feel it because the burnout keeps you from feeling that. So I was not always able to show up in spaces and smile. I was not always able to be a lighthouse for people. I had to actually very intentionally say that was a priority and that I was going to do the things to get myself in order so that I could do that. But that when I was in the burnout, I was showing up not wanting to smile, not wanting to interact, giving snippy responses or no response, right? Like silence was actually better than something I might have said, some harmful thing I might have said. Or in that instance of the patient interaction you said, right? Maybe the best I had that day was like, just let this lady go. She doesn't want me. And that maybe that was the best I had, right? So that is I have really a lot of compassion for that too. I do not want anybody hearing this to say, oh, well, now you're criticizing me because I can't smile and be like a ray of sunshine to every single person I meet. I'm failing at that too. No, of course not. You're doing the best that you can. And as you restore yourself, as you begin to feel stronger, please also overcome those cultural and societal barriers that tell us we shouldn't smile even when we're happy.
Yeah, for me, I'm kind of the reverse. I feel like I don't necessarily feel that, but I know the importance of it. So I have to be very intentional to be throughout my workday instead of just nose to the grindstone, just walking with kind of that resting bitch face down the hallway. And I actually have to intentionally, like, because it's not that I'm hating my day. I think that's just like my default. And so I kind of have to be more intentional about being like, smiling at people and making good eye contact and say, hey, like I really enjoy working with you guys, because I am feeling that. I think it's just hard for me to express it. And maybe that's kind of an ER thing too. We all kind of are supposed to complain about our day and just point out the negatives as opposed to the positives. So that's something I always have to be intentional about, I think, kind of focusing on.
And then when you do it, does it feel nourishing or does it feel draining? Like if you
It
smile at
definitely
someone
feels
and say, "Hey, how you
nourishing.
doing?"
Yeah, I feel like when I do it, it actually makes me happier too. Yeah, like when you smile, I think you kind of start to feel happier. Whether you smile because you're feeling happy or not, I think that act actually does make you happier. So,
I think that's the other kind of falsehood is that that's sort of like something I'm giving away, right? Like I don't feel very energetic or I don't feel very joyous right now. And so what am I going to smile and give away my like one glimmer of joy? But it like re-amplifies. Joy is an immeasurable quality. You can never use it up and you can never have too much. So if you give away a little bit of joy, it gives you back more joy. So never be afraid to smile at someone.
yeah, that's a great point. You talk about how important it is for us to mentor and teach the next generation of healthcare providers, because that's something we're always dealing with, right? There's students everywhere. Like if you work in healthcare, you always have that opportunity to both teach and mentor, the students that are around and the next generation of healthcare providers. And I remember when I was a brand new EMT, like the crew that I rode with on the ambulance made such a huge difference. If you ride with a crew that's super burned out, they hate their jobs, as a brand new EMT, you've put 6 months into a class, that might do it in for you. You might be like, well, this was a mistake. This is not what I thought it was. I don't want to do this anymore. Versus riding with a crew that's having fun all day. They're really great with the patients. They're working their hardest and taking the patient seriously. And then you're like, wow, this is a great job. This is exactly what I want to do. Can you kind of talk about your experience when you were a medical student and how that affected you?
My goodness, it was horrible. Um, I definitely got through with grit alone and endured many terrible faculty members and terrible supervising residents who were not interested in my development or well-being at all. And just kind of that, like hurt people philosophy, like this whole, stuff rolls downhill for sure. So again, I'm not here. I have all compassion for all the people who traumatized me every step along the way. And yet recognizing that that happened and that I don't want to perpetuate that anymore, right? And I don't want other people to continue perpetuating that. We have young people leaving the field. We have people not going to med school. We have people choosing to not even join health careers in the first place or leave midway through the pathway because we've made it so toxic. How are we ever going to save the system if we're pushing people out? So, yes, I unfortunately am one of the ones, many, most, who had a very terrible time in med school. Residency was better. The place where I did residency at Vanderbilt was actually a great, very supportive program. And that's where I had my first daughter. My husband and I were both residents there, and we did feel like we could thrive in that situation. And then when I went to fellowship, that was one of the most intensive training programs that existed for any pediatric specialty. So that was really, really hard as well. But my biggest burnout episode happened when I was an attending. So we can't really say it was the training environment that was to blame. And I hear that from so many people in every specialty too, because then it was the I'll be happy when philosophy. I'll be happy when I'm an attending. I'll be happy when I'm making money, pay off my student loans, whatever. But then life never gets any better, and that actually really is psychologically damaging because you were really delaying gratification for some imagined future, and then when you got there it wasn't what you imagined it to be, and a lot of suffering results from that.
Yeah. One of your last chapters talks about advocacy and how important speaking up for our patients is and trying to improve the systems that we work in. Why is advocacy one of the last steps in the book?
Oh boy, I go back and forth in the model about how where to put advocacy all the time, but I do believe, and this is so important right now when so many people are feeling really beat up by the system, whether that's your close system, your hospital system, or whether that's our healthcare payers, insurance companies and CMS, or whether that's the whole country and everything that's going on. If you are being beat up at some level, you may not be the one who's ready to stand up and be a change maker with the capital C, right? Advocating for policy change when your humanity is being threatened by policy is a really tough place to be, right? So depending on what affinity group you're in or sector of the population you're in, you may have more or less capacity. Your personal capacity, right? If you can barely get out of bed, you certainly may not. I would not recommend that you use any of your energy chips for the day, writing letters to Congress or going to Washington or trying to do any policy change. That's not for you right now. Restore yourself a little bit more. However, the reason why so that's why it's at the end, right? You got to get you straight first, but you're on the path towards it. I keep it there as the line of sight. You're going to be able to help people once you get yourself together. So the big change you want starts with you. There's a direct line. Sometimes people can't tolerate it. The time it takes to actually recover is too much time stepping out of the other focused activities or advocacy activities. So sometimes we'll build in a little bit. And like one technique that I work with people a lot is just to have that journal. Write down all the things that you want to change so that when you have recovered your energy, when you do feel creative and strong, you know what you want to work on. You're not doing nothing. You're doing quite a lot right now. This is rest is a really amazing act of advocacy to say, I'm going to rest myself, restore myself so that 6 months from now, a year from now, 2 years from now, 10 years from now, I don't know how long it takes, I'm going to be able to make changes that help the system. That's incredibly powerful. And then, of course, the most simple is like be the change. Even if you're just showing up a little less burned out or a little less reactive or a little less cranky, that's going to have a ripple effect that is going to change the system, even if you're not doing specific policy change initiatives or any quality improvement work or anything kind of like more structured. So I don't want anybody to ever feel like, oh, I have to sign up for a committee or I have to be writing letters, that I have to be doing a formal advocacy activity. Changing yourself is a huge act of advocacy.
Yeah, that's a really good point. Like working on yourself and actually getting yourself to that mental state where you have the creative room, I think, to actually advocate properly without it causing further stress and further burnout. That's really good. the longer I am an ERPA, I'm going on 6 years, so I'm still pretty relatively new at it, compared to an ER physician that's been doing it for a decade or more. I feel like I struggle more and more with perfectionism, especially now that I feel like I'm pretty competent. Like I know the patients I'm comfortable caring for without getting a physician involved. I'm very comfortable finding that line of where I feel like a physician does need to get involved, but I struggle with perfectionism, I think, because I have the time now to be like, is this chart perfect? Did I do the exact right workup? Did I do the exact right physical exam? How do those of us that struggle with perfectionism work to overcome it?
Wow. You know, perfectionism is one of the harder strongholds to clear amongst this healthcare audience because this high achievement habit and striving for excellence in a field where excellence is necessary, right? So whenever I start to talk to people about good enough, they're like, well, I can't be good enough. People are going to die. And I'm like, that's not what I mean. I mean, in the places where good enough is good enough, right? Like note writing, like whatever the way you've laid out your thing, or if it takes 5 minutes versus 4 minutes, does that really matter? Those types of things. We can get perfectionistic about anything. I think being able to catch it is a great first step. Hi, perfectionism. How you doing today? See you. Is a great first step. I think recognizing the places, just reframing excellence and perfectionism are two separate things, and that I'm actually going for excellence. And then again, just start interrogating those thoughts, right? Is this actually driving me towards excellence? Or is this just that perfectionism habit? It's a habit of thought that you've fallen into because you've been in it your entire life. And this habit doesn't serve, right? It doesn't serve me to constantly ruminate. Was that the best way to say that? Or could I have done something differently? It's gone. Like just let it go. Um, and so I think that I would say probably don't target the perfectionism right away. Do some of the other things, and the perfectionism will collapse once you kind of have the other kind of pillars or practices in place. That's how it worked for me, at least. I didn't start out saying I want to topple my perfectionism. I said there were other sort of specific things that I wanted to tackle, and then the perfectionism just kind of, it didn't have any room. There was no room for perfectionism once I started saying I have to have good boundaries and I have to live by my values and I have to interrogate my thoughts and live within my zones of control. I mean, perfection, anything you're perfectionisming about is definitely outside of your control. You're trying, that's exactly what it is, right? We're trying to bring things into the inner circle that actually live in the outer circle.
Yeah, wow, that was really well articulated. That makes so much sense in that context. Like recognizing that perfectionism is not the same as excellence, because I think that's maybe where some of my disconnect kind of happens sometimes is I think that I have to have that to be excellent, and that's not true. It's recognizing, oh, hey, that's that perfectionism thought that's crossing my way. I can say hi to it and move on from it and focus on something else. That's a really good context. Where can people find you and get copies of your book? I know you're working on other stuff, so just tell me where people can find you. We got through all my questions, so that's great timing. I just want people to be able to find your book where they can find it and find your work where they can find it.
Fantastic. We aim to be one-stop shopping, so just head to our website, emmajonesmd.com, and you will find there where to buy the book, any courses we're offering, one-on-one coaching opportunities, as well as whatever else we're cooking up on any given day.
Awesome. Well, thank you so much for your time.
Thank you. It was nice to talk to you.